New question, the member from Parry Sound, Muskoka.
Thank you, Mr. Speaker. My question is to the Minister of Health and Long-Term Care. People in northwestern Ontario have a life expectancy 2.9 years shorter than the rest of the province. Speaker, a report from Health Quality Ontario has confirmed the reality facing Northern Ontarians. They are more likely to have cardiovascular disease, have limited access to healthy foods, be obese, and they are more likely to commit suicide. Northerners navigate a healthcare system with reduced access to testing and to doctors. The ministry's own Rural and Northern Healthcare report identified these issues in 2011. Speaker, when is the minister going to address the regional disparities in our healthcare system?
Hear, hear.
Minister of Health, Long-Term Care.
Well, Mr. Speaker, this is a very important issue, and I appreciated the report that came out from Health Quality Ontario that pointed to the work that needs to be done to address the as they themselves indicated, a lot of this has to do with the social determinants of health, but to address the fact that individuals in the North do have challenges in the North because of residing there, because of the nature of the situation that are different than in the South. But, Mr. Speaker, we are making enormous investments in the North as we are throughout the province. Since coming into office, we've increased the funding in northern hospitals by 55%. We just announced recently in Thunder Bay a new cardiac centre which will provide both vascular surgery as well as cardiac surgery. And I want to thank both members from Thunder Bay, both MPPs who worked hard to be able to make that a reality, and I'm happy to speak more in the supplementary.
Supplementary.
Thank you, Mr. Speaker. Again to the Minister. Well, Speaker, research published in the Canadian Medical Association Journal about cardiovascular events shows that the three healthiest LHINs are in the GTA. On the other hand, the three of the four least healthy LHINs are the Northeast, Northwest, and North Simcoe Muskoka.
Shame.
It is deplorable that today where you live in Ontario is a determinant of your health and your life expectancy. Speaker, I'm going to the Northwestern Ontario Municipal Association conference later this week. What does the minister have to say to the people in the Northwest LHIN?
Good question.
Thank you. Minister.
Well, that we continue to invest in the North, Mr. Speaker. The first nurse practitioner-led clinic was in the North in Sudbury. We have 42 family health teams in the North as well. And I know if the member opposite read the CMAJ report, I think it was likely the one that referenced the Health Quality Ontario report, which was the report that we commissioned through an agency of government to actually provide us with that additional valuable information. And they pointed to areas where we could continue to improve and where investments should be made. We've made over $157 million of investments in additional surgeries and bringing down wait times in the northern region as well. Mr. Speaker, there's a lot of work to do across the province. I'm very fixed at the North as well because of the unique challenges faced there and what we can do more to improve the health situation of our northern residents.
Answer.
Mr. Speaker.
Thank you. New question, the member from Timmins, James Bay.